Hello everyone, and welcome to this demonstration of WA Primary Health Alliance's adapted version of the Australian Government's General Practice in Aged Care Incentive, Patient Monitoring and Tracking Tool. For simplicity, throughout this session, I'll be using the acronym GPACI to refer to the General Practice in Aged Care Incentive. This spreadsheet has been designed to support your practice in documenting, monitoring, and tracking patients residing in aged care homes. It's a practical tool that can help streamline your internal processes and assist responsible providers in meeting the required GP visits and care planning services for each patient under GPACI. On the first tab, titled Instructions and Disclaimer, you'll find detailed guidance on how to use the spreadsheet effectively. In today's video, we'll walk through the key sections you'll be interacting with so you can confidently integrate this tool into your workflow. The instruction sheet also has a link to the GPACI guidelines in the introduction for your information. Let's begin by navigating to the Data Validation tab. The Data Validation tab has been designed for you to be able to adapt the names of the residential aged care homes that your practice visits, as well as the names of your providers. The information you enter on this tab will link directly to the monitoring sheet. Once you've entered in those details, you'll likely not need to return here unless something changes. Next, we'll navigate to the Potential Incentive Calculator. This tab gives you a helpful estimate of the total incentive payments your practice and responsible provider could earn, assuming all service requirements are fulfilled correctly. On this tab, you can see 4 sections that are white. These are the only editable sections on this page. So first of all, you could put in the number of aged care homes that you service. So for an example, we can enter 2 aged care homes. Enter in the total number of residents that you see across all of those facilities. As an example, we'll put 20 residents. The next tab is asking you, of those 20 patients, how many would you expect to register for the GPACI program? So we're going to say of the 20 patients, 15 are likely to register for the program. The next tab here is for information purposes only and is providing the average number of patients per home. The next section here is looking at percentage. So it allows you to consider, of the 15 patients, what percentage of these patients do you expect to have the visits go according to the modelled plan? So if we say 80% of those 15 patients will achieve all of the requirements to meet the eligibility for the incentive, it will calculate for us the incentive. The GP's incentive would be $3,600. The practice would receive $1,560 and the total incentive would be $5,160. You can obviously change these numbers to suit your practice and to give you an indication of the potential incentive that you may receive. Next, we can take a look at the monitoring sheet. This is where your GPACI patient database will be housed. Before we dive into each column, what it represents and how to use it, I want to highlight a helpful time-saving tip. Rather than entering patient details manually one by one, you can download a complete list of your GPACI patients directly from Proda. Once downloaded, simply copy and paste that list into this spreadsheet. If you're unsure how to access or export your patient list from Proda, feel free to reach out to us at practiceassist@waffa.org.au. We're here to support you through the process. Now let's explore the structure of the monitoring sheet in more detail. So as you can see here, we're looking at very similar details that are also stored within Proda. But we're looking at entering first name, last name, date of birth, gender, residential aged care home name, whether the patient is active or not, who their responsible provider is. This needs to be the provider that has been assigned within GPACI as their responsible provider. And then this first section here, titled MyMedicare Requirements, is really looking at the setup and the administrative side of the program. Most of this work will only need to be done once, and it will remain the same. So the first column is, are they registered for MyMedicare? What was the date of their registration? Has the GPACI incentive been added to their MyMedicare registration within PRODA? And has the patient been linked to the responsible provider? And what is their assessment start period? The assessment start period needs to match the start period that's been assigned in PRODA in the GPACI registration. When you select the start period, it will automatically adjust the end period based on the start. So as you can see here, this patient has been registered on the 10th of July, and we've checked that they're also registered for GPACI on the 10th of July. So it's a July start period and it has an end period of June. This column here will automatically tell you what quarter the patient is in based on today's date and their start period. So for example, a patient who has a start period of July currently, today on the 26th of August, they're in quarter one. However, it is the quarter one of their second year, but it is still their quarter one of their year. In comparison, let's put in another patient. Just entering in their details. And if we were to say they were registered on the 1st of November last year, they're linked in PRODA, linked to the provider. So their start period would be October. Even though they registered in November, their GPACI was also registered in November, it falls within the October period. So this patient has an end date of September and their current quarter is quarter four. So this column here is called the critical annual service required quarter one. Currently for the patients that were registered in July at the beginning of the program, some practices may have received a letter from the Commonwealth advising them that the annual services for the previous year have not been met, which means the quarter four payment was not paid. In order to avoid missing out on the incentive for the next 12 months for the patients, the letter advises that you need to provide an annual service item prior to the end of quarter one. This column allows you to track those patients that you've been notified that have not met the annual servicing requirements for the previous year. We expect this may happen in future quarter four patients when the annual servicing has not been met. So if this patient was on that list, we would change this to yes. It allows you to see and know that this patient needs to have one of those annual servicing requirements in quarter one to be eligible for the incentive. Once you've changed one of those to yes, so let's say for example, this patient has a medication review, the flag will go yellow and you can remove that because they've met the requirement. So basically you can go in here and remove the yes because now you know they've met the requirement within that quarter. Looking at this next section here, This looks at the care planning service requirements, which is often referred to as the annual servicing requirements. This is where you need to track the 2 annual services across the full year. It looks at the residential medication management review, the comprehensive medical assessment, the case conference, and the review or care plan contribution. When you say yes because a service has been provided, you can see that this one has a yes, so the flag has gone yellow. If we said this patient has also had a contribution to a care plan, the flag will go green. So they've now met their requirement. In terms of this section, you might choose to look at your Q4 patients and those who are in Q1 and have had a yes in column N. Making sure that they've received their annual servicing requirement to meet the needs of the annual requirements. The next section looks at your quarter requirements as per each quarter. These have no dates attached to the quarters because the patient's date for the quarter is going to be dependent on their start period. So if we're entering details for these 2 patients, and this one starts in July, today is Q1. So we would look at this and we would select from the options available. Whereas for this patient here, today is Q4. So we would be looking at entering their visits today into the Q4 section. So for this patient in Q1, we might expect that they've had their second eligible visit already because they've had 2 visits in 2 separate months. Whereas your Q4 patient today, you might say they've only had 1 eligible visit because they've had a visit in July, but they have not had a visit in August or September. Again, the flags will change depending on the level of where they're at in meeting their requirements of that quarter. So red if they've had no services, yellow if they've met some of the requirements but not all of them, and green when they've met all of the requirements for that quarter. So what we can do is add some more patients into this monitoring tool. If we go to the data validation tab, we can go in here and change the names of some of those facilities. And now looking at the doctors, just as an example, now if we go back to the monitoring sheet, we enter in some more of those patient details. First name, last name. When we look at the RACH names, we've got the names that we've typed in earlier. Likewise for the doctors, we can now see the doctors' names. It allows you to adapt these lists specific to your practice. Add in a couple more patients. Just adjust these doctor names to suit the list and the RACH. Then we can also go through this section. So if we look, has this patient registered for MyMedicare? Yes. They've registered on the 16th of the 1st. Registered for GPACI on the same date, and they're linked to the provider. So this patient will have a start period of January because it's within the January quarter, and they're currently in quarter 3. Whereas if we look at Sarah Smith and we say she registered on the 12th of May, yes, she's registered. Yes, it's linked to GPACI on the same date with the responsible provider assigned. She's going to have a start period of April because May falls within the April quarter, and an end period of March. Let's do one more for last patient. So as you can see here, we've now got 2 patients with a start period of July, even though they've started 12 months apart. So one was 2024 and one was 2025. They're still currently right now in quarter 1. So as you can see, when you add the assessment start period, the colours change for these patients based on the assessment start period. This allows you to look at the quarter in comparison to today's date, and then you might choose to look at who are all of my quarter 4 patients. So if you click on the triangle above, which is the filter, you might choose to unselect all and say, just show me my quarter 4 patients. And then you can just see your quarter 4 patients. This is very beneficial for practices that are looking at large numbers of patients and even potentially across multiple facilities. So as you can see quite easily, this patient is quarter 4. They've not met any of their annual servicing requirements. We have got one first eligible visit in here that we entered earlier. So if we take that out, they've not met any of their annual services, they've not met any of their quarter 1 requirements. When you're filtering, it's important to remember if you're wanting to filter by multiple columns, to make sure that you filter them in the right order. So if we go back here and we show all of the quarters, it will show all of our patients again. If we look at, for example, make that one Dr. Armadale, we say we want to say, let's just look at Dr. Armadale. You can see there's 3 patients there for Dr. Armadale, and then we might say also we only want to look at quarter 1. So we're filtering first Dr. Armadale and then quarter 1. To remove them, you can just go select all, or you can say clear filter, and it will bring everything back and clear the filter on that column. And same again, we can clear the filter from the responsible provider, which brings back all your patients again in the database. So when we're looking at the quarter requirements, if we're looking at this list of patients that we have here, so the first one is in quarter 1, so we're saying second eligible visit completed. The other quarters haven't happened yet this year, so you would expect them to be blank. This one here is in quarter 4. So You would expect that in Q1 they've had the second eligible visit completed, in Q2 and also Q3. And then you might say in Q4, this patient has had one visit, but they haven't had their second visit yet because the only visits they've had have been in July. The second visit, in order to be eligible, must be in a separate month. Likewise, if we went through and did all of them, you would be looking at this third patient. Currently today they're in Q3, so you would expect to not see anything in their Q4 until we hit October. And then you would also be applying any of their annual services within this section for each patient. The last tab here is the provider printable version. We've created this so that if you're working on this information and you're wanting to share it with your GPs in a printable version, where they can clearly see which of their patients need what care at what service, as well as who has also met all of those requirements. It's a good, easy way to print it out. It's deliberately been done in black and white. It will always have today's date at the top, so they know when it was printed and when the information is relevant to. Now, all of this information will automatically populate across. None of the information on this page is editable. However, you can filter the same as on the monitoring sheet. So again, if we just wanted to look at, for example, Dr. Armadale, could use the filter above the responsible provider name, and it will only show Dr. Armadale's patients. So you can see from here, it doesn't have the flags on the other page because of the colors. However, the headings at the top tell the doctor how many services are required, and it will automatically tell them how many they've had, and that comes from the other sheet. So test patient has had 2 annual servicing requirements, and they've had 2 eligible visits in the first quarter. You can also see that that patient is in Q1, so you wouldn't expect to see any other numbers here. Whereas looking at Sarah Smith, she's in Q2. She hasn't had any annual services, and she hasn't had any visits in Q1 or Q2. So if we were to go back to the monitoring sheet and look at Sarah, and we went into her file and said, actually, Sarah has had annual servicing. She's had a medication review, and she's had 2 eligible visits in the first quarter, and she's had 1 eligible visit in the second. If we now go back to the provider printable version, you can see it automatically populates across. So Sarah is in Q2. We can now see she's had 1 annual servicing item. She's had 2 eligible visits in Q1, and she's had 1 eligible visit in Q2. Again, if you are wanting to clear your filter, go back and select all, or you can clear the filter from the responsible provider there. If you were not to filter anything on this page and you are wanting to print it, I would highly recommend that you at least go into the responsible provider name and remove the blanks, which will remove all the additional lines. This sheet has been set up to show up to 1,000 patients. So if you were to print it without filtering the blanks out, it would be 16 pages long. So just remove the blanks before you print. When you print the document, in order to fit it on the page, I do recommend using fit all columns on one page. Otherwise, sometimes it will be much smaller and almost impossible to read. So again, it's important to remember that the provider printable version is not an editable page. other than the filtering, and all of the information on this page comes from the monitoring sheet, which is your working document. We hope this demonstration has helped you feel more confident using the GPACI patient monitoring and tracking tool. If you have any questions or need further support, please don't hesitate to contact your assigned primary care navigator or practice assist at 0862784900 or email practiceassist@wafa.org.au. Thank you for joining us.